It's a delight and privilege to catch up with Dr. Pavan Verkicharla. Pavan, he's a scientist and he's also the head of the Myopia Center at the LV Prasad Eye Institute in Hyderabad. Thank you so much, Pavan, for taking the time.
Thank you so much for having me here, Vinod.
So, Pavan, I know you have dedicated, your work, especially your research work, towards myopia. How big is myopia in India, and is that something that is growing? Could you share a little bit on your findings?
Thank you. To start with, I think the myopia, we say it's a global pandemic. It's going to be one of the major public health concerns of 21st century. The reason for this is we are looking at a big jump in the numbers, not just in India, but throughout the world. To understand, okay, whatever people say in relation to what's happening in the world or the global context, we did a study to understand, are we following the same trajectory? And not to our surprise, we found India, especially children living in urban region, 5 to 15 years, we are looking at 1 out of 2 individuals to have myopia by 2050. That's why we're looking at about 50%, much similar to the global scenario for the children living in India.
And do you think the primary eye care sector is equipped to deal with this issue, or is this something that one needs to keep in mind in terms of capacity building and training and everything?
I think the term myopia management or myopia control, I think, is used multiple times in multiple places or multiple contexts for that matter, and seems like it's seen as, oh, rocket science. You need a lot of equipment, but the reality is you don't need a lot of equipment there. All you need is, if you're an optometrist, if you have a decent setting like a retinoscope, you have your visual acuity charts as a part of your regular practice, I think that's sufficient for you to start myopia management. Now, to go to next level, to decide what myopia management do you need, when do you prescribe treatment, it's good to have some set protocols. For example, we developed impact myopia guidelines so that everybody can start with whatever they have. There's no set to say, okay, you need 10 number of instruments to start myopia management. I think that's a myth. So whatever we have, I think we should be able to do justice to our patients. Yes, there is a need for capacity building. There is a need for training to ensure you are ready with your protocols with a minimal investment.
And I know you've been doing a major annual conference on myopia. And I understand your third conference is coming up, shortly. Could you maybe talk a little bit about that conference?
Yeah. So the conference, name of the conference is IMARC. And the full form of that is Indian Myopia Awareness and Research Conference, IMARC. So we started this in 2020 during the year, sort of did not get into the, or during the time of pandemic 2020, we started with online version. And then now we are organizing 4th version of IMARC. The goal of IMARC is very straightforward. Let me put it in 3 prongs. The first one is to say that, hey, there is a platform for all the eye care practitioners and researchers interested in myopia, come on board to talk about myopia so that everybody is up to date. Number 2, we want to keep everybody aware of the latest advancements in this rapidly evolving field. What we had 5 years ago is gone, and what we have today may be gone in the next 5 years down the line. So we want to, number 3, in that context is, can we have evidence-based myopia management? So in a nutshell, we are looking at, okay, we are creating a focus group, bringing everybody together to talk about myopia. Let's learn from each other. Nobody is sort of indicating, hey, this is the way to go forward, but can we all come together, develop our own consensus, ensure we're doing justice to the patient or a child with myopia?
So just in closing, I mean, it's fantastic work you're doing, and best wishes for your conference. But if there's a bit of advice you want to give to parents of young children with regard to myopia, what would that be? And then, be very keen to hear from an expert like you.
First of all parents, please be aware that myopia can be prevented. And number two, myopia progression can be controlled. I think two major. So I'm talking about myopia awareness now. There are multiple solutions out there. If you ask your practitioner, hey, my child spectacle prescription has jumped from -1 to -2, don't leave them. There are ways to control that. Easy solution to start with, there are behavioral modifications that we recommend, lifestyle modifications. You have options in the spectacles, contact lens, in the eye drops format as well. So just be aware there are options. Ask your eye care practitioner for it, and then the child will benefit.
So thank you so much, Pavan. What we'll do is, when we broadcast this, we'll also put a link to your conference site. So I know many people might be interested to come and attend the conference. So thank you so much for taking the time.
Thank you so much. Just to highlight, the conference is for all. It's not just practitioners, but the students can attend, the researchers can attend. There is something for everybody in it, with a lot of international, national speakers coming from different parts to educate us, to learn from us as well. I think there is a big scope for us to use this as a platform and be ready to combat myopia. Thank you, Vinod, for having me.
Thank you so much. Thank you so much for taking the time. See you, Pavan.